An important issue, behavioral health, but mental health professionals may not be as easy to come by in rural areas. According to a study this year from the American Journal of Preventive Medicine, 65% of non-metro counties in the U.S. don't have a psychiatrist. That same study finds that 47% don't have a psychologist. Fortunately, though, a big boost to Avera's e-care program could help change that. Keloland's Kelly Volk shows us what this means for behavioral health in rural areas.
Avera Health's e-care program just received a $7.8 million grant. The money comes from the Leona M. and Harry B. Helmsley Charitable Trust. While telemedicine is not a new offering from Avera, this chunk of change will help build a 24-hour telemedicine behavioral health team.
This is huge for not only South Dakota, but our region. As everyone here knows, behavioral health is in a crisis mode across the entire upper Midwest.
Eventually, the e-care program will also offer mobile support to first responders when they encounter someone in a crisis.
Oftentimes, if they don't have that assessment at that site, people get transferred. Sheriff's departments transfer people across the state unnecessarily to emergency departments.
Officials say the grant money will help get patients the right level of help earlier on.
In the behavioral health world, we know that mental health conditions like depression, anxiety, or bipolar disorder often coexist with other public health crises that are currently very much in the news, such as the opioid epidemic, alcohol abuse, overdose, and suicide.
However, increased access to mental health professionals may just help change that. In Sioux Falls, Kelly Volk, Keloland News.
This particular grant will be spread out over the course of 3 years.